I can't believe how well the patients really did respond to it. We didn't have to do anything, they just came and booked. My name is Alicia, I'm a registered nurse. I'm involved in the quality improvement activities for the practice. I help to plan a lot of what they are and then look at how we can implement them into the practice.
My name's Alicia Johnston and I'm a medical receptionist at Providence Medical Belmont.
My name is Michael Footer. I'm a full-time GP. I'm one of 4 GPs that work at the practice. I've been here for 5 years.
One of the ways that I often look at what quality improvement activities I can implement is by looking at our PHN report. I looked at how we were going. You can see your little graphs for how your practice is going. And I saw our cardiovascular risk score and it was terrible. I was actually really embarrassed that it was so bad. I said to the team, no, we can't have this happening. This is what we're doing next. And I showed them the graph on the report. We can't have our patients being in that situation. We used PenCat to extract some information and get the data for who was eligible for having a heart health check. And from there, we looked at how we could implement the recalls. We did get a bit of input about how this would work, working out the workflow, so who would do what and which roles would be given to each of the team members, whether it was reception, the nursing team, and then the GPs.
Patients responded really well to the heart health check pilot. They were very interested when calling up. Whenever our recall messages went out, there was a lot of interest in it.
Something I really enjoyed about participating in the recall pilot was the support that I got from the team. They were able to step me through some things, how we can go about doing the recall through the SMS, how to go through the data gathering processes, which is something I'm not that great with the technology side of things. So that was really helpful to have someone who was able to support us to go through step by step, how can we do this easily for the practice.
We did use the little checklist to let them know what was entailed in it because there was a lot of interest in what it was actually about too. This was quite new for the practice.
The Heart Health Check Toolkit was really valuable for us right across the board, from the reception team through to the clinical team. We found the resources there were great when we were doing the recall. It gave some prompts for the reception team to know what to say when our patients were calling in and saying, I've received an SMS about this heart health check, what is it? I don't think it would have been as successful if we didn't have those tools available to us, if we didn't have that support from the program there and having it all set up, ready to go. It was just take it and run with it kind of a thing. So we've done your heart health plan today, and part of the information that we covered was about some of your dietary risk factors. So I'm going to give you some information to take home with you that's going to explain a little bit more about what some of those risk factors are. Something I would say is be ready for your responses. We were blown away by how many people called us up and said, I just got a text message about doing a heart health check. When can I book in? Can I book in? I really want to have this heart health check.
Patients that have been recalled, they deeply appreciate what we're actually doing. I've only had good comments from the patients, so they find it an enjoyable procedure. They realise why we're doing it. I think the adherence will be higher than doing a normal standard medical consultation where it's done as an add-on script or being seen for another problem.
By the end of the 3 or 4 months that we participated, we were able to get the next report back from our PHN, and the graph was off the charts with how well we had done by improving the data, by improving our patients' healthcare, and we were just absolutely thrilled that we were able to have such a positive impact.